Good morning, this is Dr. Chirag Dave with Advanced Urology, and the case you're about to hear today is from a dear patient of mine, Nancy. Nancy originally presented to me with urinary retention. She had presented to the emergency department, unable to urinate. She had significant residual amounts of urine in the bladder, and a Foley catheter was placed to permanently drain the patient's bladder. So when she saw me for treatment options, her case was difficult because number one, her age, number two, is a condition called pulmonary fibrosis, which means she permanently requires supplemental oxygen in order to breathe. This makes her a poor candidate for anesthesia or more invasive procedures. She also has other health conditions such as glaucoma, which makes her not a good candidate for some of the conventional medications we may try using in this situation. But we were very happy that Nancy chose to work with us, and I'm happy to share her results here with you today.
My symptoms started with not being able to empty my bladder, and I wasn't aware how much urine that my bladder was retaining until it became painful, and I went to the emergency room and I was diagnosed. They put a Foley catheter in and sent me home and referred me to any urologist of my choice. So after doing some research, I liked the reviews that I read, and I chose Advanced Urology for my treatment. I was apprehensive because I didn't know the doctors or any of the front people, but I was greeted with warmth and made to feel very comfortable from the very beginning. And then when I got into the treatment room and met the nurse's assistant, she was really very reassuring and comforting and sympathetic. And it was life-changing, the treatment was, because I have glaucoma, and I also I have pulmonary fibrosis, so I'm on oxygen full time. And if I would have had to have lived with the Foley catheter added to all that, it would have made me totally bedridden, and I'm not done. So it was life-changing for me, and it was just a blessing. And I was so grateful that I had made this choice. And I knew the minute I met Dr. Dave, he conveyed to me, his persona conveyed to me that he was sympathetic. I'm 78 years old, and with all the other maladies that I have, it would have been easy to have just blown me off and let me live on a Foley catheter forever. But this was just like a whole new life for me. It prolonged my life and made my quality of life much better. I would say, by all means, go and get yourself checked and see if you're eligible for this procedure, because it's well worth it. It's uncomfortable at the most. It's not, and I wasn't put to sleep because I'm a high risk put to sleep. So I was able to tolerate the procedure without any complications or any trauma, and it's life-changing. There's no reason for you to live with a Foley catheter or to live uncomfortable with the way your body's functioning. First of all, the procedure in itself, I had never heard of it, and just that it's something like that's available to you. And secondly, I was just so grateful that I picked out a urologist that was compassionate enough to offer me that as an option, rather than just to say, well, you can, here are the Foley catheters, here's how you work them. I'd say you're in good hands, both mentally and physically, because this disease affects you mentally as well. It's debilitating to have to walk around and with your bladder half empty, and also if it's retaining fluid excessively. It's very, very uncomfortable.